Lexis.
Hi, how are you?
I'm good, fantastic.
Nice.
How are you?
I'm okay. I'm good as well.
Yeah.
Thugging through. Yeah.
See,
Have you had a
your
good
tie.
week? My tie.
White
Today I
shirt
had
and
to.
tie.
Yeah, I had to.
You know, Bukum Banku said, "Well, a man can never be too careful unless he wears a white shirt and buys a new car."
A new car. I see.
So today I see that Kwame wants to be careful. You know,
I'm very careful today.
Your white shirt. Right, Kwame. So it's good to be here another Wednesday, and
Yes.
good afternoon to all our listeners.
On behalf of the men, I need to say thank you because the men say that Charlie, you've helped them a lot these past couple of weeks. We've been having conversations about men's health,
Right.
and we are not even done.
We're not
because
done.
today we have a very important aspect to consider.
Absolutely. So today we're doing a wrap, and Kwame, today we have to open the phone lines a bit earlier.
Okay.
You know, to get them our fellow men opportunity to call in and then ask a few questions. Right. So today we're going to wrap up, and I know we've been talking about, say, the prostate. We've looked at prostate health, prostate infections. We've looked at benign prostate enlargement. And then we also talked about what makes us men biologically, testosterone.
Right.
All right. But Kwame, last week I think we got a question on WhatsApp, or I think you posed that question when you asked me, how do you take care of the testis?
Yeah.
All right. Since the testis is the factory that produces testosterone,
Yeah.
the hormone, very important to us, and also spermatozoa, which is very important if you want to be able to make a baby or bring the next human. So the testes are very, very important for procreation and also for all the benefits that we get from hormones. So we need to take care of it better. Well, I mean, the testes are found in a structure we call the scrotum. So what you see hanging between a man's legs, or thighs, would be the scrotum. All right, that sac, and in it, then you would find the testes. Well, I mean, would you be surprised if I tell you the testes are at the pair? I mean, everybody's got to get a pair. That's number one.
Oh.
Right.
Okay.
Number two, would you be surprised if I tell you they're not of the same size?
They're not of the same size.
Yes.
Really?
Philip, I told Philip before he came on air, he was like, but who is checking? And I'm like, oh.
Wait, you let me check. Hold on.
Why checking?
No, I have to unzip, but I just realized the camera.
The camera
on,
is there.
yeah.
It will worry you.
Yeah.
I can read you there. I can first camera and you.
Yeah, but now the cameras are
now
watching.
the cameras are. So when you get home, then you check.
Yeah.
Right.
No,
so,
but if you are listening now, please check and tell us.
actually, that's good. Yeah.
If you are listening now, me here, there are cameras on me, I can't check. But you, I'm sure you are in your car,
Hey, Kwame.
park and check. Or if you're in the office, go to the washroom, go and check and come. Or if you're at home, there,
free. But Kwame, alternatively, if you are at home, you can get somebody to check for you.
Okay.
So I think that's even better.
That's if she's home.
Oh, Kwame, I don't know who you switch she needs.
Nanka Bema Nanko check him.
I said somebody. But maybe your son can even check it for you. So,
okay. So
right.
they are not the same size.
So they are not the same size. So it's very important information because we don't want people to get overly worried because of that.
Okay.
All right. Except the difference is like very significant.
Okay.
Most of the time, if you're not thinking about it, you probably wouldn't know.
I mean, I didn't know. I never thought about it that way.
Yes, but they're not of the same size. But you must always have a pair. So that's where we start off from. That if you don't have a pair, that's one of the first challenges that we have. If you don't find that pair in there, then there's something we call cryptocate testis. Cryptocate testis, or undescended testis.
Okay.
Because the testis it's an abdominal structure until about the 8th month or so of fetal life. Then it begins to migrate under the influence of a certain hormone that it produces by itself. Then it migrates through the groin and then finds its way into the scrotum. And therefore, when you are born, one of the examinations for the male baby would be that. So, if you don't have it and it's in there in your abdomen, your core body temperature, Kwame, is 37 degrees. All right? But the optimal temperature for function of the testes is about 34 degrees.
Okay.
Yes. And that is why it has to hang outside.
That's why it has to be out of the body.
That's why it has to be out of the body. So if it is not, we need to find it. We need to find where it is. So the male baby is born, and then we would examine the scrotum. And if we find only one, we'll have to trace it. Sometimes the descent was not complete.
So I'm coming on this temperature issue, eh? So if the 37 degrees is a little too much for the scrotum to perform, you know, there are some people who live in countries that temperatures rise to like 40,
Mali,
45.
Burkina Faso.
I think even in Dubai recently,
Chad,
temperatures
Dubai.
reached like 50 degrees Celsius and things like that.
Yep.
What is the state of their...
Well, you see, this is when I go for events. The rare time I go for an event, I see the ladies carry some fan.
the small standing fan. The standing fan, the mini standing fan.
I think that I have an idea. I need to patent this. Please.
You know what I'm saying?
I'm patenting this idea. You know, we're going to do one that, you know, say I don't know who to be on the, you know, so we're going to do one that we fix there.
You fix
then
there.
you press a button somewhere. You know, but Kwame, you raise a very important, and I was going to come to that temperature. So, you see, we're warm. So if the scrotum hangs between your thighs,
Right.
and it can provide heat for the scrotum and then the testes, warms it up. Unfortunately, some people tend to wear some underwear made of material that doesn't breathe.
Okay.
So now I don't see it on the market a lot, but there used to be this craze about nylon briefs. All right, those don't breathe, so it traps a lot of heat. Then the guy will wear the boxers on top of that, or she briefs, so then he will wear boxers. Then some of them will pull up some, as we call it, pee pant. Then we wear jeans. A guy, why? What's the problem? All these things can generate too much heat. The real purpose of the testes migrating from the abdomen out there, you are defeating it by packing up all of these things.
Okay.
So Kwame, anti-pay is actually good.
Wow. I should have said this earlier.
Kwame, I needed to give the reason so that it makes sense to people.
Yeah.
Let it hang.
Oh, okay.
Kwame, that's a new hashtag.
Let it hang.
That's good.
All right. I mean, from tomorrow day, I mean, guys, you know how we do.
Yeah, exactly.
We're all letting it hang.
Yeah.
If they ask you, you should understand.
But who asks you? How will people know?
You see, when the thing hangs like, there's a reason why we wear briefs, boxers, and all those things. Oh.
Share. There was a reason.
Doc.
What they here to ask? Philip will say that the show. Well, what reason? You know, just
we have reasons, but we can't say.
We can't say.
But you see,
okay.
we have to protect certain things.
Okay.
You understand? The visuals are important. It has to be decorous. If we don't, the site will be
too much for.
Yes.
You know, I saw a Mele Josie. It will be too much for her. Oh. Right, so that's a very, very important way of taking care of our scrotum and our testicular health. Another point I want to make, Kwame, is about trauma. Guys, we like to play football. Kwame, if you are not even playing football, you play tennis.
Yeah.
Kwame, it's about area.
Oh, yes.
You know, you get hit in the groin with a tennis ball, traveling at such speed.
Oh, no, it's terrible.
You know, you get kicked. Football can get kicked. Somebody swinging that whole lower limb or foot, and then you get caught in there.
Yeah.
Or the football. Look at Roberto Carlos, and then you are in that wall. You know, so we all the time we see footballers trying to protect the crown jewels
Yeah.
with their, hands, in a fist manner, covering the groin area. Because anytime you get a kick in that area, the testes, they hang by a cord. And it's not just the spermatic cord, but you've got also blood vessels, all right? The spermatic vein and then the spermatic artery. Blood vessels that take blood to the testes and then drain blood away from the testes.
Okay.
So if you get hit, so can you imagine the thing hanging, the testes?
Yeah.
It spins
Okay. Yeah.
anytime, it gets hit. So it spins on its cord, and that is what we call torsion. So it strangles itself, literally,
Wow.
and cuts off the blood supply, and the testes can die. It can cause a lot of pain. So sometimes people get kicked in their groin, you get intense, sharp pain, but then it dies down a little bit, and then we brave it and we continue to play the game. Only for you to go home, you're sleeping in the night, and you start to get excruciating pain. If you don't get to see a urologist quick enough for that twisted, cord to be reversed, then Kwame, you may lose your testes for life.
Wow.
And then if you lose it, it means your hormone production goes down, but most importantly too, you don't get to produce enough spermatozoa. So sometimes it can twist and untwist, but then the damage would have been, done.
Okay.
So we should be very careful about trauma to the testes.
So the effects of trauma or damage to the testes include what? Lack of production of sperms?
Yes, sperms, and then also the hormone testosterone. So that you begin to have all of those, the reversal of those symptoms. The benefits that testosterone gives you. So testosterone is going to do what? It's going to cause you to have libido, for example. So then all of a sudden, you don't have enough testosterone, so your libido levels drop.
Is it also directly related to erection?
Well, not directly, but if you don't have the desire for sex, then you're not going to have an erection.
Okay.
But if we look at the erectile dysfunction issues, there isn't like a direct link with testosterone. But testosterone is the one that gives you the I want to feeling.
Right.
Then other mechanisms would kick in. So if that is not there, then likely other things are not even starting for you.
Okay. Okay.
I get that. Then there's the infertility bit, the sperm production. So sometimes when men come and you do the sperm count, it's very, very low. You want to go back and trace, have you had trauma in the past in that area? So we have to be careful when, because we do a lot of sport. Men do, a lot of sport. Again, weightlifting, particularly in the gym, it puts you at risk if you don't take the necessary precautions. All right, you're exercising in the gym. The belts that we use.
Yeah.
It's all supposed to prevent herniation,
Okay.
inguinal hernia. All right, and the herniation is just you pushing your intestines through that groin path into your intestine, and that puts pressure on the testes and all of that.
Okay.
So that is also not the best. So these are some of the little things or things that I want everybody to be aware of. Don't dress up too much. It's already very hot. We have a tropical climate. So I like the boxer shorts, the typical boxer shorts, because kind of home.
Yeah.
And
from afar.
And from afar home. At the moment you get home, then that's even, it's okay. Just that, and walk around the house, because there's real reason why the testes move from your lower abdomen into the scrotum so that it can hang freely. 34 degrees.
Does it shrink as you age?
No, it doesn't. But even not with age, but different times of the day.
Okay.
Because there's a certain muscle, that goes into the scrotum. We call it the cremasteric muscle. All right. And that muscle, when it contracts, then you get a sense that your whole scrotum sort of like shrinks.
Because sometimes it shrinks. I say,
What's
going on?
But when you're getting stroked in the inner part of your thigh in certain areas, then the cremasteric muscle goes into contraction, and then the whole thing. The whole thing can shrink.
Ah.
So this one is free
Sometimes
tip
I
for
will
the, exactly.
some.
So it
It's
shrinks
okay.
as
It's
well.
okay.
So that's all the anatomy and then
I
the
read it in a
physiology.
book. I'm not talking about me. The way people are.
Okay. You
looking
read
at
it in
me
a
like-
your anatomy textbook. Yep.
Okay, if you have any questions regards to men's health, and we're not limiting it to, we're not limiting it to scrotal conversations.
Yes.
We've talked about testosterone. We've talked about prostatitis as well the past couple of weeks. If you have any questions, you can call us on 0302216541 or send us a WhatsApp message on 05511119997. I know a lot of men have questions about, men's health, their, crown jewels.
Yep.
And you can feel free to call us and ask Doctor what your concerns are, or anything that you find maybe untoward that you'd want him to clarify.
Right.
Atua Fully in Jabin says, Lexis, the footballers are really protecting their valuables. Yeah.
Absolutely.
Okay. And please ask the doctor whether enlarged prostate can ever shrink and by what method? Medicine, surgery, or any other method? That's from Sam.
Right. So, Sam, yes, it can. All right, but not always. So, generally, our approach is always to use medicines, and if it doesn't work, then we go the surgical route, where the surgeon would have to, reduce the size with his knife. But yes, we can reduce the size of the prostate.
Okay. Hello.
Hi, Lexis. Good evening.
Good evening, sir. What's your name?
I'm Emmanuel, calling from La Paz.
Right,
Good evening to Dr. Safo.
Yeah, Doc is here. Hi, Emmanuel. Let's hear you.
Yes. Doc, this one I'm asking for a friend, not myself.
You go explain, Taya.
You are such a kind friend. Please go ahead.
Yes, thank you, Doc, for understanding. So I wanted to ask, I am getting the impression that I have an STI. I'm not too sure. But I'm getting some rashes that are a bit, it itches actually around my thigh area and my genitals as well. And I did a little research online. I'm getting the impression it's TB. But, I traveled. I just returned, so I'll be going to the hospital tomorrow, possibly. But I just wanted to know if you can give me a head start. What possibly could be causing this problem? It's actually on my fingers as well, and around the genital area.
Okay, so Kwame, as we do it, we don't go into individual, diagnosis, on air. So what I'd suggest is that let's talk after the show. Of course, everybody gets the number, and then we can have a conversation after the show. Again, when it comes to things that you can see, getting visuals on it also is very, very helpful. So yes, it may be an STI, it may be something else, but let's talk after the show.
Certainly. Thank you so much.
All right, Emmanuel. Thank you so much. 0302216541. Brighton East Legon sent a message a little earlier when we asked to check whether the sizes are the same. And he says, I've known mine all along. I thought it was a problem.
Okay.
One is like half or a little bigger than half of the other. Oh, I see. Okay.
Yeah. So, well, not so much, but yes, there are always those differences, and sometimes also it's the height.
Yeah.
It may not be one is at a lower level compared to the other.
Yeah. Me, I had a question.
What's
A
the
pie.
question?
It's me pie.
The testes.
Yeah.
Oh yes. I mean, depending on the amount of trauma, so road traffic accidents and depending on the amount of force that's been applied to it, a bit me pie can rupture.
Sekusia.
But it doesn't take much to break an egg, But yeah, it can. It's just like it's a tissue, so you can traumatize it to that extent, and it can,
But why?
I can see
why did they put feet? It's okay. Hello.
Hi, Lexis.
Yes, sir. Welcome.
Thank you so much, my brother.
All right. Let's hear you, sir. What's your name?
This is Philip.
All right. Let's hear you.
Okay, this one also asking on behalf of all young men.
Oh,
Yes.
right. Thank you.
Yeah.
You are kind.
Doc, so as a young man and this testicle issues, not leaving out the prostate,
Yeah.
what advice would you give us to let us have a healthy life when it comes to our testes?
Right.
Yeah.
Okay, so again, I would repeat it. Make sure your testes can breathe. All right, so don't pack too much underwear. Be very particular about the type of material. Cotton preferable if you're going to wear briefs. If you're at home, please, anti-pay is good. Make sure again, minimal trauma or no trauma. So if you're doing sport, be very, very careful about it. Kwame also talked about vitamin E, vitamin C in your diet. Very, very important. It helps with the whole sperm maturation, process. So these are some of the things that we do. Again, too much alcohol doesn't help your body tissues function. And sperm production is a certain biochemical process. And too much alcohol doesn't help. All right?
Too much alcohol doesn't help.
Doesn't help at all. So I know a lot of young men, unfortunately, doing binge drinking Friday night, Saturday, Sunday, and things like that. So if you really want to protect, look, the things that you are looking for, you are getting the aphrodisiacs for and all of that. The testosterone can do that for you. So why don't we think about how naturally we can boost its production rather than you do all the things to bring it down and then you start spending money on aphrodisiacs just to get your libido back.
Right. Okay, let's see who's here. Hello.
Hello, Lexis.
Yes, sir. Welcome. What's your name?
My name is Larry.
All right, brother. Let's hear you.
Okay, so Lexis, when you said about it shrinking, right? I experienced one some time ago, but I noticed that I don't know if the scrotum peels off. But there's an instance where I realized that it shrunk, and then there was the skin peeling off. I thought it was very unusual because I've not been active. I'm not sexually active. So I don't think it's an After a while, it just got okay. I also asked Doc if it's normal, that it shrinks and then it peels off and everything.
Oh, okay.
It's very weird.
All right, Larry.
I mean, there's also the distinction between the scrotum, which is the sac, and the testis. So the testis itself won't shrink. They're pretty much standard size.
Okay.
All right. But because we find it in the scrotum, and the scrotum can become, the muscles can contract, and then it shrinks, it becomes small.
Yeah.
And then it can also relax, and then it becomes, it appears bigger. So there's a scrotum that shrinks, but the testis itself, standard, the size is pretty much standard.
But he said the skin was peeling.
Right, so because it's skin, it can suffer so many other things that is not necessarily STI. So we can have dermatitis, eczema, on the skin on our forearms, the skin of our back. So the scrotum too can have the same things. But again, doctor will have to get visuals on that before we draw a conclusion one way or the other.
Okay, a representative of the ladies who are listening.
Wow.
Just sent
stakeholders.
The stakeholders. They just said I should tell you, Doc, to lower your voice when it comes to the advice on anti-pay.
Oh.
Yeah, because
they don't like it.
Because they said that this advice on anti-pay to let us have plenty kids. I don't know the correlation.
What's the correlation?
I don't know. I have no idea.
Correlation and regression.
Anti-pay will cause plenty
children
of kids. I don't know. But Doc, over to you.
Just easily maybe and then they will be chasing something.
They can't resist. They see things dangling. That's all right. Irajo sent us a message.
Yeah.
I have two boys. One is 4. I noticed that his scrotum was kind of attached to his penis. I've taken him to see different pediatricians. They examined him and said both testes are present, so there's no need to worry.
Right.
But when I compare his to his brother's, who is younger, I see a difference. Should I be worried?
So long as both are present, that's the most important thing. Present and present in the scrotum. It could be that it did not descend fully to the base of the scrotum, but probably it's at the base, right at the exit of the canal, the inguinal canal, which is probably also at the base of the penis. All right, so maybe it's a little bit higher up, but so long as a pediatrician is seen and says both are inside within the scrotum, then I don't think there's anything to worry about. If she's still worried, she can do an ultrasound scan. All right, an ultrasound scan of the scrotum. It would locate the testes and give us measurements as well, and probably that will set her mind at rest. So she can talk to us after the show as well, and then we can do that. But I think there isn't much to worry about.
There's so many questions. I know we need to wrap up, but let me just throw this one in. Maybe you might have something to say about it. Lexis, please ask doctor, what could be the reason when a man experiences erection very well, but whenever he gets closer to a woman, it doesn't come at all?
Hey, while we were there, I have to go and think about it and come properly. Right, so probably man can get what we call the nocturnal penile tumescence. He can get an erection.
What? Nocturnal day?
Penile tumescence.
It's a tummy womb.
Tummy womb. You know, where you get a spontaneous erection at dawn. All right, that's the nocturnal bit. All right, so there's no problem with that. But there are psychological aspects to erection, and then there are chemical aspects or hormonal aspects to erection. Then there are anatomical aspects to erection as well. So if psychologically he has a particular, because I've seen it before, people come and tell me that if I'm with Irajua, no problem. I go to Akusia, problem. It is not, there isn't an anatomical or physiological problem, but there's a psychological barrier, and that is where I am looking at with this particular scenario. But of course, we need further and better particulars.
Okay, so it could be psychological.
Could be, because if you can get it up, what is the thing about getting closer to a woman?
Yeah,
I'm sure he gets it up because the libido is there. And libido is about thinking about the sex.
Could it be stress?
That the woman is stressing.
No, I mean he's stressed maybe during those times.
Yeah, so all of those things can come into play. That okay, at this particular moment that you need to perform, then that's the moment where you have a lot of stress. That's why I'm saying that you need to have a lot
more information
about what is happening.
All right, we can do the rest offline because a lot of people have questions. So how can they reach out to you?
Right, so the number is 0501 477 340. If you want to reach us on WhatsApp, it's 0501 477 340. And Kwame, I know that people shy away from these kinds of conversations, but this aspect of our life, it's the cornerstone of how most of us enjoy life. So no shyness, just reach out to us, come over, let's have a conversation about men's health.
Dr. Yalsaf is the CEO of Medicas Hospital, East Legon Hills. Thank you, Doc.
You're welcome, Kwame.
Utumiso. Nyamye, utumiso. Tumisens. Nocturnal. Doc, what's your fine thing? Nocturnal
penile tumescence.
Tumiso. Tumiso.
Joy 99.7 FM.
Afternoon.
Oh, afternoon.
Please, Momo.
Deposit or withdrawal?
Withdrawal.